Subscribe to our YouTube channel and press the bell icon to get the latest updates.
Hi, welcome to Ilanomics. Coronavirus outbreak or COVID-19 remains the big story and the biggest issue that's occupying all our minds. There is the question of protecting livelihoods and there is the bigger question of protecting lives. What is the Indian government doing right and what should it be doing more? Professor Ila Patnaik will talk to us about it today. Ila, you have very clearly divided your argument this week on protecting lives and protecting livelihoods. Why have you separated the two in such a very simplistic way?
You see, because there is always this temptation by governments to protect livelihoods. People hate it when suddenly they are unable to earn anything. And that's very, very natural. And suddenly their incomes go down. And countries like Italy tried to do that. They tried to protect livelihoods. They said only northern Italy will be shut. People moved to southern Italy. And that spread the virus across the country. And when you are not able to then save people, then you actually lose both lives and livelihoods, particularly in democracies. Once you start losing lives, which we saw that in the UK as well, where Boris Johnson said that people may lose their loved ones before their time has come. But then very soon, democracies don't accept that. So you get the worst of both worlds. You lose both lives and livelihoods.
And you are saying that India has placed the emphasis on protecting lives at the cost of hurting GDP.
Which is actually our only choice.
Can you elaborate on that?
Yeah, because if we tried to go the Italian way, in fact, I've cited this paper which has been done by the Bank of Italy COVID monitoring group, where they try to look at what they did right, what they did wrong, and what other countries need to do. And what they find is that if you try to do the opposite, which is you try to protect livelihoods, then you keep places open, you don't do social distancing, tourists keep coming. They did not shut down their tourist spots and their museums and restaurants on time. And then when they had to shut down, much more. So they lost not just on the livelihoods later, they also lost on the lives later. So that is really what India is, I think, trying to avoid. And in a democracy, we don't have too much choice, because once, we can't hide bad news the way China hid bad news.
But this path ahead, because nobody knows how long this will last, it is very unpredictable. So you are trying to say that we have to hunker down and just wait for it to pass and protect the outbreak from getting out of hand? Again,
that is the only strategy that we have. So what did Italy try to do? It thought it had public health care. It had good health care. I mean, compare it to ours, okay, which is really, even in normal times, our number of beds per 1,000 population, our number of hospitals per 1,000 population, it is all inadequate. Okay, they thought that it was okay, they'll be able to handle handle patients when they get sick, but that was not possible. So I'm saying that yes, we have to hunker down. Of course, we have to not go into panic mode. We have to try to prevent the disease, do lots of testing, prepare for patients to be tested, whatever their symptoms might be, if they have had exposure, so that we can contain the disease. Let's just assume that it spreads. Let's just assume that we are not first focusing on shutting down and social distancing, and then it spreads. Such a densely populated country with dense urban areas. You have to have any facilities in rural areas. Suppose people go back now and they will not be able to get health care, and it's going to be a nightmare.
You also made that distinction between urban populations and rural populations, especially people who migrate and who are working in the cities, and if they, God forbid, contract the infection and go back, like you say, it's a multiplier effect, and that could even hurt our food production.
If we are not able to stop it on time, then yes, if people start going...
I don't want to create panic here, but it's a possibility.
Yeah, so I think that stopping it, isolating, social distancing now, before we are going to send people back to their villages, because ultimately if people fall ill, if they take the disease back, it would be again upon the government to try to then take care of them, and that is very, very hard. So I think we are going before other countries even. We took the step of trying to shut down things, knowing perhaps that for us, even if GDP gets hit, there are many economists trying to make predictions about GDP growth, 3%, 4%, 5%, and so on. It's their job and they have to do that. Stock markets are very volatile because after all, stock markets are trying to talk about, they're implicitly going up and down based on what they think will happen to the economy. Now, we don't know the extent to which the virus will spread, and we don't know the amount of time that it will take for the economy to come back. We don't know how long we might have to shut down. I mean, it's possible that it goes like the Spanish flu. It goes down in summer when we think, the heat might kill it. We hope and we pray that, our latitude, tropical weather might reduce its spread. But it might come back again when the winter comes. So, because we don't know the effects, stock markets are very, very volatile. So, my argument is that it's perhaps a bit premature to be able to actually predict the growth rates of the economy now, because they are going to go down. You will have a contraction. Airlines, tourism, just many more. There will be a contraction when people work less, go out less, spend less. But that's something that we might actually prevent this from taking many more lives and doing much more damage.
But you also talk about how the recovery can be potentially faster. What makes you say that?
You see, if we are able to protect businesses, if we are able to protect lives, then it really means that it can bounce back the day you feel that, now it is safe. It might be safe because of a vaccine. It might be safe because we might find cures. It might be safe because it's 45 degrees. But once we feel that we are safer, if we have taken steps to preserve the strength of our businesses and human capital, then we should be able to bounce back quite fast.
And we have to plan for that through things like, you say, pay people on time despite slowdown and coronavirus impact, delay payments, some of those things.
Yeah, some of those things, including tax breaks for businesses. So there isn't much fiscal space, but
I think fiscal deficit is out of the window now.
But that's okay. After all, fiscal deficits and debts were for war times. So if we try to think about fiscal deficits now, then we'll be in trouble, because after all, the economy is going to slow down, tax collections are going to be lower, so it has to be done on borrowing. It might have to be inflationary. So we have to tackle the problem now. In the long run, we are all dead. And
there has been that talk about another rate cut, but I don't know what another rate cut will do.
They should perhaps do more rate cuts, because you see, businesses have to pay back interest. They have to service their loans, and this is not a time when businesses are booming. So you might need to, the US Fed has slashed rates. Many countries have, pumped liquidity into the system. At least whatever we can humanly do, we do, while we are fighting the virus.
And you make a very interesting point, Ila, when you end your piece this week about the working age population and how the size and the health of the working age population is critical to growth, which is why this whole argument of containing is so important.
Yeah, so far the evidence seems to be that it is hitting the elderly and the unhealthy. This is not to say that it is not hitting anybody who's young. It is, but the proportion of population that is being hit among the young, among the working age below 60, is far lower than those who are above 65 and are retired and old. So if you ask me what is the impact on the economy, I would say that in the short run, yes, we are likely to see a big downturn, even a contraction, but in the long term, the impact is going to be limited, because when we do long-term projections, it's a cold calculation, but when we do long-term projections of the economy, then it's basically your working age population. So your capital, accumulated capital, and your working age population, and the biggest and the driver of growth in India. We've talked about the till 2040 that we're going to have the youth, and of course demographic dividend. We of course want them to be healthy and well educated, but so far the way this virus has behaved, if it does not mutate into more dangerous territory, then I would say that the silver lining is that we are not looking at a long-term slump in growth hope. If this is how things go, given today's its behavior speaking today, absolutely.
So there is a silver lining to this crisis, but like I said, it's all based on what we know today and the progress of the outbreak. Thanks for watching this episode of Ilanomics. We will be back with another episode next week, and hopefully we will have better news by then. Keep watching us, and we will come back next week, and subscribe to our YouTube channel.